That's for the TV. Okay, I'd like to call the Budget Review Committee to order. It's April 16th, 2018, and we're in the Aldermanic Chambers, and it is 7 p.m. Would the clerk please call the roll?
Thank you, Mr. Chair. Alderman at Large Laurie Wilshire.
Here.
Alderman at Large Brian McCarthy.
Present.
Alderman at Large Michael O'Brien is present. Alderman at Large David Tenza.
He's present, but in the bathroom.
He's here.
Okay, he is present, yes. Alderman at Large Shoshana Kelly.
Here.
Alderman Jan Smith.
Here.
Also in attendance is Alderman Lopez. Also in attendance is Bobby Bagley, Heidi Peak, Jackie Avila, Janet Graziano, and Bob Mack. And the chair, Richard Dow.
Maybe about the 15th meeting you'll get that.
I'll get it.
Yeah. Okay, the first item is public comment. I don't see anyone. Communications.
There are none?
Unfinished business.
There is none.
New business resolutions.
We have before us R 18021, relative to the transfer of $50,000 from the Department 194 contingency account number 70100, general contingency to Department 109, civic and community activities, accounting classification 56, outside agencies, for the purpose of providing funding to Harbor Homes for their role in the Safe Stations program. Mr. Chair, I would like to make a motion to recommend final passage.
Okay, the motion on the floor is for final passage of R 18021. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carries.
Thank you, Mr. Chairman. Also before us is R 18022, authorizing the mayor and the city treasurer to issue bonds not to exceed the amount of $2,500,000 for the fiscal year 2018 sewer infrastructure program. This, Mr. Chairman, was also assigned to the Board of Public Works to appear in their docket on 4/26/2018 agenda. There is a public hearing scheduled for 4:30 at 7 p.m. in the Aldermanic Chamber.
Okay, this is one of several motions this evening. I'm going to ask for a motion to table pending the public hearing, which is scheduled for April 30th. Alderman O'Brien.
Thank you, Mr. Chair. I would like to make a motion to table R 18022 pending the public hearing scheduled for April 30th on 2018 at 7 p.m. in the Aldermanic Chamber.
Any discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed? Motion carries.
Thank you,
Alderman
Mr.
O'Brien.
Chair. Also before us is R 18023, changing the purpose of up to $514,000 of unexpended bond proceeds from various wastewater projects to fiscal year 2018 sewer infrastructure program. Mr. Chair, this is also assigned to the Board of Public Works and is going to appear on the 4/26/18 agenda.
Okay, again, this will be one that we'll table. Alderman O'Brien.
Thank you, Mr. Chair. I would like to make a motion to table R 18023.
Motion on the floor is to table R 18023. Any discussion? Seeing none, all in favor signify by saying aye.
Aye.
Those opposed? Motion carries. Alderman O'Brien.
Thank you, Mr. Chair. Also before us is R 18024, creating a special revenue fund for the 211 Main Street building. There is a public hearing scheduled on 4/23/18 at 7 p.m. in the Aldermanic Chamber.
Okay, Alderman O'Brien.
I would like, Mr. Chair, I would like to make a motion to table R 18204 pending the public hearing scheduled for April 23rd, 2018 at 7 p.m. in the Aldermanic Chamber.
Okay, the motion is to table. Any discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed? Motion carries.
Thank
Alderman
you.
O'Brien.
Also before us is R 18026, relative to the transfer of up to $100,000 from the Department number 191, School Department, account number 81100, capital improvements, into the school grant activity, school infrastructure grant funds. Mr. Chair, I would like to make a motion to recommend final passage.
The motion is to recommend to the full board final passage of R 18-026. Any discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. Alderman O'Brien.
Thank you. Mr. Chair, I would like to make a motion to take from the table R 18019, which is the budget.
Okay, the motion on the floor is to take R 18019 from the table so it can be discussed this evening. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Okay, so tonight we will be going through the Public Health and Community Services Division. The revenues are on pages 43, 44, 45, and the appropriations on 179, 181, 183, and 185 to 186. Mrs. Bagley, would you like to lead things off?
Yes, thank you. Sorry, Alderman. It's our pleasure to be here this evening to present our fiscal year budget. And what we thought we would do is take the opportunity to go through some slides that describe our scope and the work that we do, and then each of the department managers will go through and talk about their budgets and as they are submitted in the proposed budget for fiscal year 19.
Okay. All right, good.
The first slide here just really talks about public health and what it is that we do at the division as an entire entity over at 18 Mulberry Street. And public health is a profession that focuses on people, it focuses on the workforce, and it focuses on the setting in which we actually do our work. And so you can see here the definition is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. And although this definition was put together back in 1920, it's still very relevant today to how we do the work that we do at the division, understanding that it takes a collaborative effort with us in the position as leaders in public health with our organizations and our partners as well. There are several priority areas of service that are focused on with the work that's done in public health, as you can see from these bullets, that focus on epidemics and disease, protecting against environmental hazards, prevention of injuries, those that might be intentional as well as injuries that are unintentional, the promotion of healthy behaviors, and then also preparing and responding to and for emergency events and the recovery of those. Our mission at the division is to promote, to protect, and preserve the health and the well-being of the Greater Nashua Region through leadership and community collaboration. And as you'll see from our presentation, all of the services that we provide are based on us accomplishing this mission. Our vision with the services and the work that we do, but the staff, is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. This is the organization chart, which shows how we are structured there, with my position being a direct report to the mayor's office. The Board of Health is a governing entity for us as well, that we run public health issues by and report to and meet with them on a monthly basis. And then again, getting oversight and direction and approval from the Board of Aldermen. And you can see that there are 4 distinct departments at the division: community health, community services, a welfare department, and environmental health. And that just shows also some of the staffing that's included in this fiscal year budget. The next set of slides focus on some of the services. It's not an exhaustive list, but it gives you an idea of the diversity of services and programming that's provided at the division. Under community health, there are a few programs that are listed there. Under community services, environmental health, and welfare. The work that we do falls in line with what's important for us to work effectively across a whole public health system. And so in the center of this slide, you can see where it has the public health agency is identified, and then you can see all of the partners that help us accomplish the work of that mission and that vision across those programs that were in the 2 previous slides. And this slide actually comes from the public health program services out of the CDC, and this is the expectation for public health departments across the nation and how they work with that, within that public health system with our partners. There are core functions and essential services that are particularly important for us to be able to do over at the division. And each one of these essential services, it gives an example of the different types of activities that we're responsible for. So for instance, one of the things that we do under monitoring health is that we create a community health assessment. We do that on a cycle of every 3 years, and that requires the collaboration of our community partners and staff at the division to get that done. And then each one of those just really kind of calls out different examples of the work that's done under those essential public health services. The core functions are the assessment, which is collecting information and analyzing data, assuring that we can have programs in place to meet the goals and objectives of public health services, and then policy development, where we provide insight or input to policy at the state level and also at our local level as well. And all of these things that we do at the division really stem from us being able to assure that individuals are not impacted by diseases or injuries in any way that keeps them from maintaining the best health that they can. And so we look at making sure that we can address social determinants of health that could interfere with an individual leading a healthy life. An individual is going to impact a community. And so our work is usually done at the community level, taking a population-based approach. And the determinants of health that can impact individuals will stem from either their economic stability, education, or barriers to education, social and community context. So what's in our environment that helps a person thrive and be happy, things that focus on health and access to health care as well. And then what does our neighborhood look like, or what are some of the resources in our neighborhood? All of those things are aspects that are defined as social determinants of health that we, again, assess and make sure that we can address. We have to collaborate with our partners. We have to collaborate, with legislators, with the aldermen themselves, in order to be able to do this, because not one entity in our community, not one service organization can do all of this without collaborating and working well together. In this slide, I just wanted to share with you some of our accomplishments that we've done working across those departments, across all of those different services that we provide. During this fiscal year of 2018, we've celebrated our first year of national accreditation, which is a huge achievement. Nashua has the first and only accredited health department in the state. Out of 2,000 health departments in the country, 3,000 in the country, only 200 are accredited, and so we are in that number, that 200 number, which is a significant accomplishment that demonstrates the level of performance that comes out of the division. We were also able to kick off our 10th annual Public Health Week celebration last week, which was very successful, again, with community partners engaged. We've completed our 3rd community health assessment, which gave us information about where the community sees priorities for health in Nashua. One of the accomplishments that I'm very proud of for the managers and the staff at the division is that they developed mission and vision statements for each of their departments that aligned with the overall mission of the division and vision of the division as well. And then we had the opportunity, because of the work that we've been able to do, to present at 2 national conferences on some of the programs or some of the processes that we have in place working with our community partners. The next set of slides will go through some of our goals and objectives for fiscal year 19 that align with the funding needs that we have to be able to be effective and efficient in our delivery of services. I won't read everything that's on the slides, but it does give you an idea that we have a strategic plan for how we're going to operate. So our first goal is to promote, protect, and preserve the health and well-being of our citizens in the Greater Nashua area, and to be able to accomplish that through these 5 objectives that I've listed here on this particular slide. Of key importance is being able to maintain our staffing, to be able to deliver those core public functions that you saw and those essential services, and then also be able to have the funding that we need for ongoing sustainability of our programs and our services. And a second goal, we want to be able to improve environmental health services using quality improvement processes, which we've begun already. And again, these 3 objectives look to making sure that we can accomplish that through evaluating and improving our food service plan, promotion of or promoting registered environmental health specialist credentialing, and then making sure that we pursue certification in professional food safety to, again, enhance the services that we provide and the competency of the staff as well. For goal 3, we want to be able to lead our community health improvement plan priorities in Nashua and the Greater Nashua Region, and this is where we work with our community partners to get this accomplished. And so we serve on committees and that address public health issues across different organizations and agencies, from the state level to national associations. And then we also make sure that we provide a public health perspective to problem solving by sitting at tables with other agencies in the community, and then make sure that we have some representation all through the year with some of these other agencies and their programs. Goal 4 is to make sure that we can provide ongoing efforts and to work with our community partners to address the opioid crisis. As you know, that's been a huge issue that's impacted our city for the past 2 years at a rate where we've seen overdoses and deaths, which are preventable. And by making this one of our priority areas, our goal is to see if we can get that number down, increase education in our community and awareness, and then also make sure that there are prevention services to address these issues as well. And so again, this is one where it takes the whole village, and your Division of Public Health and Community Services serves as a lead agency in addressing some of these issues. Goal 5, in order for us to ensure a competent public health workforce, we provide ongoing opportunities for our staff to obtain training and development at meetings and workshops. We work to make sure that there's learning opportunities for all of the staff at the division. And then I make sure with the managers that we provide competency assessment of our staff every 2 years. And again, all of these goals, as you can see, are directly or can directly be impacted by the funding that we receive. And goal 6 is to maintain high ethical standards in public health practice, and again, through accreditation. There are standards and measures that are in place for us to stay on top of that, and we do that on an ongoing basis with some of the structures that we have in place. So here is a slide that shows what our funding at the division looks like. So with our total budget of $2,415,782, and it's broken out so that you could see how it's distributed across each of our departments over at the division. But 23% of funding covering welfare assistance costs, 14% covering community services, and as I go through the slides, you'll see where some of the other funding support comes from. Community health is supported at 23%, and environmental health at 21%, and then welfare administration at 19%. Total funding sources for the division, 80% comes from the city to support our programming and staffing, and then we have 20% that comes from grants either through Department of Health and Human Services or from the New Hampshire Charitable Foundation. And then in the corner, it just breaks out the total amounts for grant funding and the city funding. So at this point, each of our departments, the managers will talk about the services in the department and go through some of the budget changes, either on the plus or the minus side. And we didn't have many changes in our budget, as you will see. I do manage the Community Services Department, and the mission that was developed for this department is to facilitate access to programs and services that develop resiliency, promote healthy behaviors, and safeguard the health of the Greater Nashua community through partnership, engagement, and collaboration. The funding that we receive from the state allows for us to do work outside of the city of Nashua that includes 12 surrounding towns. And our vision through the work that we do through community services and some of the programming is to have an empowered community where all people have access to equitable opportunities and resources that foster and sustain optimal health and well-being. Staffing under community services. Our city-funded position includes my position, the division director and manager, an epidemiologist by 95% of city funds, and 5% is covered under a grant. And our health promotion specialist is covered fully under city funding. And then you can see that grant-funded positions includes the emergency preparedness coordinator, the epidemiologist for that 5%, a program assistant, public health network services coordinator, and our substance misuse prevention coordinator. Basically, the scope of services for the division focus on work that comes through funding from our regional public health networks. It includes our substance misuse prevention program, work that focuses on seeing and making sure we have a continuum of care facilitation for the work that's done under substance misuse. Our Regional Public Health Advisory Council falls under the grant funding, and that, again, is the oversight over the partners that work with us to make sure that we have our community health assessment done, as well as our community health improvement plan completed on a 3-year cycle. The services also include all the work that we do for emergency preparedness. And then the activities, as I mentioned, span across the city of Nashua and then 12 surrounding towns as listed here. And we have stakeholder representation from many of these towns on our Public Health Advisory Council. Some of the prevalent health issues that came out of our community health assessment that was just completed in 2017 allow for us to have priority areas of focus for our community health improvement plan. So I put a couple of slides in here that just show what some of those results were. Respondents that participated in our survey described drugs, Narcan and opioids, and addiction as a priority health issue. And as you can see in our strategic guidance for fiscal year 19, we've made that a priority focus for us. 7% of the respondents indicated that substance abuse is a priority health issue. Our previous community health assessment had this at ranked at number 3, and now it's ranked up as our number 1 focus area. And you can see the huge increase over the past 7 years with substance misuse going on in this particular, over this particular time period. One of the other things that came out of this survey was that 3.3% of the respondents identified sanitation and cleanliness as a primary issue in our community, and so that will be something that we will explore further as well. Some of the best practices that we've been able to implement have been through our community health assessment and our community health improvement plan, and these are areas that we've been able to show performance management and quality performance, I should say, through our accreditation. These are the things that they look at to make sure that these things are in place and that we're doing well with these. And so we've been identified as having best practices in these areas, as well as with our performance management, quality improvement, and workforce development. This is what led to our accreditation. And then the collaboration between us and our city partners with the implementation or participation on the integrated delivery networks, the Major Opioid Task Force, and our Syringe Services Alliance of the Greater Nashua area, as well as peer support. So under the Public Health Network Services, this is how the grant funding is broken out to support the work that we do and to also supplement what we also get from the city as well. 20% of the funding supports the substance misuse prevention activities. Our young adult leadership, which is a program basically where we train young adults how to be leaders around substance misuse and teen suicide prevention. There's about 5% or a small amount of money that we get for that, about $20,000. Our Public Health Advisory Council, there is funding that's included from the state to make sure that that leadership group meets and provides directive for some of the work that we do with our community health improvement and our community health assessment plan. And then you can see the continuum of care and the FEP there as well. And then this is how that breakout looks for our overall funding. 53% comes from grants and 47% is funded through the city. As far as budget changes, as I said, there weren't many. The two lines where there were changes were in the 53-1118 for accreditation. That increased by $2,500 because of the total number of individuals in the communities that we serve. That rate went up for us to cover. And then for water, we increased that by just a small amount there. And those are that's all pretty much what we had for community services.
Do you want to address questions by each department?
Yes, please. So I believe that's it for community services.
Community services, any questions? Yes, Alderman Wilshire.
I don't have a question so much as a comment on the hard work that went into the accreditation for this division. Really a lot of work, and they worked on it for several years before they got there. So I just want to commend them for that great accomplishment.
Thank you.
The fact that there are only 200 out of 3,000 in the entire country, that's amazing. Alderman Lopez.
Does the accreditation have anything, or does our building and our facilities have any impact on our accreditation?
When the site visitors came, they do come with a priority of focusing on the performance of meeting the measures and standards under 12 different domains. The building is not included in that, but we were cited in our accreditation as that being an area where we needed to have some improvement. And the rationale was because we need to better show how we can have access for the community because we're not totally ADA under the American Disabilities Act compliant with clients or customers coming into the building. So we were cited as far as that goes. It didn't prevent us from getting accreditation, but it was something that was written for us to look at how we could make improvements in addressing that.
Okay. Follow up, Alderman Lopez.
I just want to make a comment. I mean, every alderman sitting here knows the public health building is in major need of attention and it should be prioritized. And we just had a very impressive body which recognized our accomplishments while at the same time seems to have gone out of its way to include the obvious in its report.
Other questions? Alderman O'Brien?
Thank you. I see a lot of your funding comes not only from the city, but also from granting and everything. And am I to believe that you recently hired somebody to help with the grant writing, or is it done in-house, or?
Grant writing is done in-house. We haven't hired anyone to do any grant writing for us. It's usually the staff of each of those different services. So, for instance, for our substance misuse prevention work, the grant that's usually submitted for that, it would be myself and the staff that actually would put that together. Okay. Any additional grants that we go after, the staff would have to do that, and we work very closely with Janet, our finance manager, when we're looking at budgeting as well. Excuse me.
Mm-hmm. Okay.
Other questions? Alderman Lopez.
Sorry, Alderman O'Brien just made me think of something. With regards to the grant money that you pull in, that you're doing in-house as part of your regular roles, was there any part of the role that formerly existed as administrative assistant that either improved your ability to apply for those or offset other work that you would have to do so you would have more time to apply for those?
It would be helpful to have an administrative assistant to support some of the administrative needs under community services. Without that, then that does fall on me and the rest of the staff to take those responsibilities on, which we're working on, and with support from other administrative assistance from either environmental health or from community health.
Are there additional grants that come up that you could be eligible for, but just don't have time to try to apply for them?
We generally have to make the time to do it. So as they come up, we do take the opportunity to apply for some, and we have to kind of squeeze it in.
Do the grants fluctuate a lot year to year, or are they pretty steady?
They've been,
This year might be an outlier.
yeah. Yeah, this year, because we did have a funding source that came through that the state realized the funds weren't there to continue it. And so we actually lost the position as a result of that funding. We're almost halfway through, and they realized there wasn't going to be any funding to continue that for the rest of this year or into next year.
You also said we support 12 surrounding towns. Do any of them contribute anything to your department?
It's mostly in-kind contribution. And so they have representatives that sit on our Public Health Advisory Council that provide insight and, if you want to call it, consultation to the focus areas that we identify in our community health assessment and our CHIP. But there's no line item or funding that actually comes in from any of the towns at all. The funding that comes from the grant has in its scope of services our role and responsibility to those towns with providing leadership.
Okay. All right. Other questions? Okay. Community Health Department?
Hi. Hello, my name is Jackie Aguilar. I'm the Community Health Public Health Nurse Manager, and good evening, everybody. I'm going to go over the mission and vision of the Community Health Department.
Excuse me, could you just pull your microphone a little
Sure.
closer? Okay.
Is that better? Okay. So the mission, we are leading the way, and this is prevention with community outreach, education, collaboration, and health services in the Greater Nashua Region. Like Bobby just explained, we go over to the 12 surrounding towns, providing any community outreach, education, and collaboration regarding health services. As you're going to see later on, we do a lot of our grant work is based on a lot of education, and we educate not only the providers, but we educate school nurses, we educate the community at large. So on the vision, we have a vision for an educated community practicing preventative health behaviors. The staffing under the Community Health Department, we have under city funded staff, we have the Public Health Nurse Manager, which is me, a full-time public health nurse. Actually, we have 3 full-time nurses, and a community outreach worker, and administrative assistant. For grant-funded staff, we have 1 full-time position for a public health nurse, a community health worker, and a program assistant. These are the grant funding sources for fiscal year 19. As you can see over here, our biggest contributor for grant funding has been the immunization program through the Department of Health and Human Services, as well as the STD, HIV, hepatitis C grants, which take the bulk of the breakdown. But we also have the Healthy Homes, the LED, and the TB grants, taking a 9% and 18%. Under the community health funding sources, we are city funding at 73% and grant funding at 27%. So there are a couple of items that on our budget changes. On line item 54221, disposal services, we had a request 750, just an increase. So our Sharps disposal services just increased. And on line 55400 for conferences and seminars, we usually have the staff attend trainings and conferences, and to keep the nursing license, they have to attend these conferences and seminars, but we added a portion to pay vendors and let's see, attendance vendors in reference to the annual public health conference that we have. And we usually have it every single year, which is only for like providers, doctors, nurses, practitioners, specific to healthcare. And last year, we had about 135 participants from all over the Greater Nashua Public Health Region. The previous year, we had about 120, and the first year, we had about 120 as well. So it's very well attended. We usually have the speakers that are very, they're experts on their subject. And just to invite you, if you want to attend, it's on August 20th this year. And we're going to have the annual conference based on infectious diseases. It's called Infectious Diseases Past, Present, and Future. So on the next item, we have line item 44550, event fees. And that line was created to kind of collect the fees. After we pay the conference, we collect the fees from everybody attending, and we put it there so that we can pay the next conference for the following year. So we practically recover. Hopefully we can recover the whole amount. On our next slide, I just want to show you that the community health was recognized for excellence in immunization education and community outreach by the Department of Health and Human Services, and we are here at the National New Hampshire Immunization Conference receiving our award. And that's it. Thank you.
Thank you. Alderman Lopez, you had a question?
I just wanted to observe that based on the previous 2 slides ago now, it looks like not only did they recover, but they bring in an extra 3,000. So I made my eyebrow raise a little bit when I saw it go out, but then I realized what they were doing. They're trying to invest in a larger conference scale so that they'll bring more revenue in moving forward and be able to host a larger conference, probably somewhere not at their building.
Oh, no, it's not.
Additional questions? Alderman Lopez.
I do not know if this is your department because I always get these two confused, but do you guys address issues with lice?
Okay, so we do.
It's not my concern. It's on behalf of constituents.
We do. We usually get the information and we connect and refer, or if we need to do a home visit, or we will do it. We just kind of try to prevent this nuisance.
So you can provide home visits. The concern basically for people who may not be local to Ward 4 is there seems to be an unbeatable lice issue at Lead Street where it's just been going on for years. A lot of parents are complaining about it because they spend a lot of money addressing lice issues, buying mattresses or even just buying the shampoo, to the point where recently Walgreens was out of stock on lice shampoo. So I was wondering if that was an area where public health could take a larger lead, or if you need more resources to do that, or if the school needs to step in.
Yes.
Yes, so we had worked in the past with the school nurses, and we have collaborated in trying to control a little bit. We do a little education. We show them how to get rid of the nits and all of that. But if it's getting bigger, we have to get to know what's really happening. So we're going to have a talk.
Mm-hmm.
All set?
Yes.
Any other questions? All right. Community Services?
Good evening. My name is Heidi Pika-Koka. I am the manager and the health officer for the Environmental Health Department. Our mission largely echoes the overall division mission, but we had fun putting it together, and it was really good that all staff participated in these. And I will read it to you. To protect the public's health by promoting best prevention practices through science, education, guidance, and fostering public trust and enforcement of laws and ordinances. And our vision also mirrors our overall division mission, which is a healthy and well-informed public with a balanced integration of human health and environmental protection. Just wanted to cite a couple of places in Nashua's basic government documents, our overriding documents, that mention the roles of the health officer, and that's in Chapter 80 of the city charter, where the health officer is mentioned, and it says duties and salaries, but they didn't mention salary, and that's okay. But it also, it shows what the Board of Health was initially interested in, and it shows some of that relationship. And I didn't pull all of it out. I just pulled out 2 little chapters. And then, next one, thank you. Chapter 5, that's way too small for anybody to read it, but that's what is currently in Chapter 5 of the NROs, that talks about environmental health department. And again, it shows some of the duties, it shows the relationship, the oversight, and what our scope is. And we are entirely city funded. We have 6 full-time staff. My own position, Deputy Health Officer, who's Ren Bodwin, our Office Manager and Environmental Health Technician, Linda Alaconis, and 3 Environmental Health Specialists, April Torhan, Micah Blondo, and Gwen Williams. As just a baseline, in order to qualify to work in the department other than the office manager and environmental health technician, we require a Bachelor of Science in either biology, chemistry, environmental something. But we need to know that somebody understands or has a baseline of understanding of how disease processes work on a very, very basic level. And our office manager and environmental health technician is kind of a unique position because this person can actually conduct a lot of our plan review process. When she retires, we're going to be hurting because it's a very unique set of skills that she's learned in her over 25 years in the department. Next one. Wanted to throw a little glamour at you guys. If we know where some of the most interesting things are. And these are just some examples back in my archives of photos. And the top left is a food service establishment that's no longer in business, and that was just part of the alleyway mess. The one to the right of it was an apartment where a gentleman was living with about a foot deep of beer cans and dog waste. The one below that is a restaurant where things are directly on the floor in Home Depot buckets, and those are not approved containers. And the next one, it was a single-family home where it took a long time to get the previous owner out and into a safe environment. These are more recent. This shows well, let me backtrack a little bit. We work very closely. We're really good collaborators, and we work very closely with Fire Marshal's office and Building Department, Code Enforcement, Police, Fire, whole bunch of other city agencies. And the picture on the right is pretty shocking because this is their gas line, and they didn't know that it was too close to the fire source and that they almost blew up the plaza. And you can see that an extension cord like that is a fire hazard, and you can see the open sewer drain there is it's exposure to the sewer system through that. Next one, please. And some pictures from my archive as well. We do events as our schedule allows for just general community events for education. It's part of what I interview for specifically. We do, whenever there's a good solid training, we're involved in that as well. Howard on the bottom left no longer works for us. He's happily retired. But that's a plan review process of a food service establishment, and it's pretty labor intensive, and there's a lot that goes into it and a lot of knowledge. And on the right hand side, that's Ren Bodwin. and he's putting together some pool samples. We do microbiological assessment of all of our pools during the summertime. One thing that people don't realize is that we work very closely with local businesses. They're very often we are one of the first places that a new restaurant will come to and say, hey, what about? And I was thinking about this. And it's always very gratifying to see a new restaurant come up and become successful. But there are other businesses, local businesses, that we are in pretty constant touch with and we interact with on a regular basis. Next one. These food service, I'm not going to list them all, read them all, but you can see a list of our programs. Food service is largely, well, it is our biggest program. We have about 525 licensed establishments. Hold on. We also, I meant to say on the previous slide that our frequency of inspections is according to the 2009 FDA food code, where the FDA is always moving toward a risk-based system. And so we are mandated to do 2 times a year, but we will do 4 times a year if it's a high-risk population, poor performance, and we have a couple from time to time who we're concerned enough about that we will do them monthly until they rectify what's going on. These are some of our goals for this next year. Like Bobby had pointed out in some of our goals, we're trying to improve our food service plan review process so that the public knows what's required. We're still using the VACs to do our licensing. People laugh when I say that, but we're really looking forward to the new licensing and permitting software. We just haven't gotten there yet, but we will. And again, continue to move toward a risk-based food service system entirely and completely. Our food service categories and fee structure are old and need to be updated. And then again, the education. We bumped our revenues. This is on, I believe, page 44, I think. Oh, good. It is. We haven't moved these for a while, and you'll see a low number for the pools and spas because those all become due at the end of this month. And so we just added $1,000 for that because there aren't a lot of new pools and spas that come on board. Food service licenses, I think that that's reasonable. Change of ownerships can sometimes boost our revenue there. Solid waste licenses, septic licenses, plan review fees, and miscellaneous revenue. Next one. Then these are our changes to our budget, and we did ask for a few additional things. The first one is an additional $5,000 for consulting services. We had a shorter season last year for mosquito surveillance. The costs have gone up a little bit. I want to be prepared to deal with Jamestown Canyon, which we saw 3 cases throughout the state. It's just one of those new diseases, new emerging diseases for this area that we need to be aware of. But that vendor's fees have gone up. I don't want to cut our season short. And we also need a little bit of money for inspectional standardization contractor. The next would be, the next 2 are an additional $500 for equipment repairs and maintenance. That's our lab equipment. It's a specialized type of thing. They calibrate thermometers and our incubators. We have a new vendor, and unfortunately the cost went up. We maintain 3 vehicles, and we just went through that money far more quickly than I expected to. And we put in our New Hampshire Health Officer Association memberships into dues and memberships. So that increased that by $70. Our mileage reimbursements, we have increased travel, emergencies, and events will prompt that on the weekends. And we try to control that to the best of our abilities, but it's there. Conferences and seminars, again, that supports staff development, and educational supplies is for our prevention efforts for mosquito and tick prevention, and then miscellaneous for our safety gear and some of our other miscellaneous costs.
And I see that the mayor didn't cut any of those,
No.
so the increase is all in. Questions? Yes, Alderman Kelly.
That presentation. I was wondering about risk-based food service system. Can you explain a little bit more what that is and what resources you need to get there?
Certainly. Well, I can give you a little bit of history on it, too. We used to, our standard way of looking at, say, conducting an inspection is floors, walls, ceilings. Now we're paying far more attention to what staff are actually doing, providing education to them, helping them be more accountable for, say, upper management decisions about excluding employees, things like that. What was the second part of your question?
It was one of your goals, so I was wondering what else you need to continue to move towards that.
We need the licensing and permitting software. That's the thing that I've been waiting for a very long time. I'm very excited that we are this close. I can give you a better answer next year when we get that under our belts, because we are no longer going to be paper-focused. Our inspections will be available electronically, as will our inspection results. So it's going to put us in a completely different realm.
Thank you.
Thank you.
Other questions? Alderman O'Brien?
Thank you. Ms. Peak, some of your services that you provide, such as restaurant licensing, is that done in some of the partner communities that are part of our system as well, or do you stay strictly in the Nashua?
We only serve Nashua.
That's great.
Other questions? When you, and I think the answer is yes, but when you inspect the restaurants here in Nashua, do you grade them?
Yes, we do. We give them a numerical score.
And is that public knowledge? I know that some cities make the restaurants post them in the front.
Yes. It is public knowledge. We do not require that. It's not in our ordinances. We also, we have a specific numerical score with a failing score, which adds a little bit to our revenue stream with re-inspections, because it's a lot of work. But we're not there yet, and that's another thing that licensing and permitting software will facilitate.
So if someone wanted to find out the score of a particular restaurant, how would they do that?
589 45 30. No, 45. I can't do the number tonight.
They just have to call
the
us.
department or send us an email to environmental health.
But it's not on the city website?
It is not,
Under-
because it's in the VAX. All of that data is either in a paper file right now, or the licensing information is in the VAX.
So you don't keep a consolidated list of the score for each restaurant in the city?
It's in the VAX, but you have to understand how to access the VAX and find that page. And sometimes the number doesn't tell you a lot either.
Okay. Other questions? Thank you.
Thank you.
Welfare.
My name is Bob Mack. I'm the welfare officer for the city of Nashua, also the manager of the welfare department. And this evening, I'll just give you a brief overview of our services and any changes in our administrative and general assistance budget. So as with the other departments in the division, we spent time this past year developing our mission and vision statement. And you can see in looking at our mission statement that our focus is basically on helping individuals and families reach self-sufficiency, either through direct assistance or connection to other resources in the community. We do a lot of referrals in that regard. And our vision is basically one of universal access and inclusivity for everyone who needs those services within our community. The City Welfare Department, basically we provide interim assistance on an emergent basis for low-income residents or those with some urgent need. We do this through a voucher system. We're not a benefits program per se. Assistance is available with short-term rent, food, personal care items, utility disconnects, sometimes access to medications, and some limited transportation. Each applicant that comes to the welfare office has a confidential interview with a case technician, and the case technician reviews the personal household circumstances and makes an eligibility determination for assistance. Under the statute, RSA 165, each municipality in the state is required to provide this general assistance. And as some of the other positions within the division, the welfare officer position is part of the city charter. And this just gives you a snapshot of that and the responsibilities working with the director and appointed by the mayor of the city. Client eligibility and assistance is determined through the interview process, whereby case technicians review and verify applications and information and any associated documentation provided by an applicant. The determinations are made and assistance is granted based on the City of Nashua General Assistance Guidelines, as well as financial standards that are developed to keep up with local costs of living. The guidelines are generally static and don't really change all that much. They're based on the state statute, which is 200 some odd years old. However, the financial standards are the things that change more often, and actually recently we reviewed the financial standards, and those have been presented to the board and referred to the Personnel and Administrative Affairs Committee for review to see if those will be approved. We have a slight increase in rental costs since the last time they were passed, which was in July of 2016. So it's been a couple years since we've adjusted those or had a need to adjust those. So let's see. You can actually find links to those documents if you'd like on our city webpage. One of the things the welfare staff do is work closely with our community partners to provide assistance with basic necessities such as housing, shelter, food, utility assistance, et cetera. And while we don't provide this directly, we don't provide housing, we're not a housing agency, we don't have shelter, we don't issue prescriptions, but we can assist with meeting the costs of those things for people that, for whatever reason, can't do that on a temporary basis. Working with clients and providing direct assistance and referring them to other resources. This ties into the social determinants of health that Director Bagley mentioned early on in the presentation. We do refer a lot of folks to longer-term resources such as housing supports, benefits programs such as the State Department of Health and Human Services, disability and temporary aid cash programs, as well as Social Security and other access to health care services. The department is made up of 6 full-time staff. We are all city-funded. We don't have any grant-funded positions in the department. We have one intake worker who basically completes, she's the first point of contact for clients that come into the department. She completes intakes, does a quick assessment of their need and eligibility, and then either schedules an appointment, gives them application and requirements, or she may have them come in and speak with a case technician for a more detailed assessment at that time. We have 3 case technician staff that complete client interviews, and they also support some of the intake worker administrative duties within our department, as we don't have a direct administrative assistant position. Our intake worker does some of those, as well as some financial services as well within the department, working with the finance manager, Janet Graziano, as well. And then we also have a senior case technician who does all case technician duties, but also provides some support and oversight of the department in the absence of the welfare officer. I'm the lucky one who gets to attend a lot of meetings in the community. And sometimes when I'm not there, the senior case technician will fulfill that role. Other staff do, however, participate in various community meetings. The welfare staff have been actively involved in the development and implementation of a coordinated entry process, which is a process for homeless and at-risk households to access homeless services within our community. We participate in various community meetings such as the Gate City Immigrant Initiative, the Financial Assistance Network, Ending Homelessness Committee, which I am the chair of, which is part of the Greater Nashua Continuum of Care, and Project Homeless Connect Planning Committee, as well as the Mayor's Opioid Task Force, to name a few. So looking at the administration budget, the only real change, other than the salary increases that were presented, we have a slight increase in conferences and trainings line, a total of $300 increase. Excuse me. This will just allow our department staff to participate in more training and educational opportunities, which is in line with our workforce development goals and accreditation standards for the division. Welfare recoveries, we've actually proposed a decrease in this. This is something that's really out of our control, if you will. We don't generate a lot of revenue in the department. It's just not the nature of what we do. However, we do get some personal reimbursements from folks if and when they return to income status. We also get some reimbursement through lien payoffs if it's a property owner that has received assistance and there's some sort of sale or transfer of property. We may recoup some funds there, or if it's like a legal settlement, we may get something there. And SSI or disability benefit reimbursements. If somebody has been pending disability and they are approved, we may see some reimbursement through that. This is just a snapshot of the current fiscal year to previous fiscal year. As you can see here, and this, you may recognize this from the monthly reports that I send out to the board. It's just kind of a snapshot, if you will, of a month-to-month comparison. And if you look at the next slide, it actually is just a different representation of the same data. It just gives, I think this shows kind of how sporadic requests for and issuance of assistance can be over the course of a year. It's hard to track trends and things like that sometimes with this. However, we do see certain times of year where assistance goes down. For example, during the winter months, there's a moratorium on utility disconnects, so we don't see people coming in with disconnect notices on their heating bill. But what will happen is now that, well, there's supposed to be warmer weather coming in the spring, we're probably going to see an uptick in that because the utility companies will now start to disconnect those services. So while we have a brief gap during the winter months, we kind of see it on the back end. So we also have income tax season, which a lot of people that receive large income tax refunds, they don't qualify for our assistance because they have other resources available to them. So, and so if we look at the general assistance budget, with about 3 months left in the fiscal year, we have around $280,000 left in the general assistance budget. As you can see here, we've spent around $312,000 out of a $596,000 budget. So we have proposed a decrease of about 8% in the FY 2019 budget. You can see some slight decreases in shelter costs, medical costs, utilities, food. One of the areas we did increase was burial and cremation. We find that a lot of people, they're just not prepared for that and planning for that. And if you're on a fixed income or limited income, it's just not something that you're putting money towards. So we've had an increase in requests for that assistance. So that's, those are the proposed changes there. Even with the changes to the financial standards that are proposed to increase, we've taken that into consideration in coming up with these numbers. We're pretty comfortable that these numbers will will be sufficient. If they're not, we do have a welfare trust fund, which at this point in time has around $363,000 in it. We don't plan our budget to use that money, but we do know that that fund is there if we need it. So let's see. I think that's about it for the general assistance. I don't know if there are any questions.
Questions for welfare? Alderman Tenza.
Thank you. So, explain to me again, what accounts for the 8% decrease? Are you projecting that people are gonna need less funding?
Well, I think we've had sufficient funds to cover the requests that have come in. And even though we're increasing some of that, we're gonna be okay. We've kind of projected out how much we would spend even if there was an 8% increase in, rental costs, for example, because of what we're not gonna spend for the remainder of this fiscal year.
So you'll still be able to help and service all the folks that would need help?
Right. It should not impact our ability to assist people. As a matter of fact, municipalities cannot say we don't have enough money to help you. Little history to that. 16 years ago when I started here, I think the city had spent around $1 million out of a $650,000 budget. And they asked me what I was going to do about that. And I said, I'm not sure. But one of the things that we did is we actually brought more staff in. We were able to assess people's needs and work on referring them to other resources in the community and develop the knowledge of those resources in the community. It was also a different economic time back then, so there are many factors that affected that. But with our staffing levels where we're at now and with the resources in the community, we're comfortable with that budget, proposed budget.
Follow-up?
A different question. When people come to you, typically how long will they be working with your office before they're referred permanently to another agency? And is there any follow-up afterwards to see how they're doing, or just wait to see if they come back to you at a certain point?
Good questions. The answer to the first question, it depends. Some people come in and they just need one-time assistance. They may have a utility disconnect and, the car broke down, so they can't pay that bill. So we look at that. We say, we'll help you one time. We'll help you get on a payment plan. And by the way, you may want to apply to the fuel assistance program if you haven't done that yet, because that might help reduce that bill. So we're constantly looking at potential programs they may be eligible for. So that's one of our main goals. So the time frame, there could be some, if they're in a homeless situation, it may be more challenging. They may need temporary assistance in a motel placement until shelter opens up or until they can find affordable housing. So there's lots of factors that can impact that. So they may be with us on a week-to-week basis for 2-3 months. So it depends. And you had another question?
Do you track kind of longer-term outcomes?
As far as follow-up with clients, we don't really have any case management per se. Once we see them, if they no longer need our assistance, they kind of move on. We sometimes hear about what's happening with some of the folks from other agencies that we work with, because we see some of them at the same tables that we sit around in community meetings and partner meetings and things like that. So does that answer your question?
It does.
Okay.
All set?
Yes.
Any other questions? Alderman Kelly?
Yes. I was wondering if you could go back to the financial standards and how often they're updated. I think I wasn't fully clear.
Yes. In accordance with the guidelines, the financial standards should be looked at on a, quote, regular basis to make sure that they're keeping up with the costs in your community. So generally, every year or two, we're looking at those. If there aren't any significant changes, we may not adjust them. As I believe I mentioned earlier, because of we've seen some rental cost increases in the community. We looked at the New Hampshire Housing Finance Authority residential rental cost survey to see if there have been any significant changes. And whereas there were this year compared to the last couple of years, we proposed the increase in those costs. And as well as the CPI index, we look at that and see if there's any change.
Can I do a follow-on, please?
Follow-up?
Is there ever a reactionary look at the financial standards? Say cows are suddenly dying and we have milk goes up by 50%.
Good question. When we look at those things, the financial standards and the guidelines, they are just that. They are guidelines. We have some flexibility to look at urgency of need in a household. So if a household may need a little more so that we can help them and fulfill the humanitarian purpose of the statute, we may give them a little bit more so that they can afford the milk or whatever the needs are for that household at that period of time, if that makes sense.
That's perfect. Thank you.
Okay.
All set? Alderman Lopez?
I was questioning about the shelter services that you offer. If a family comes to the city welfare, then they're eligible for shelter support, like by sending them to a motel or some situation like that?
Depending on the circumstances, generally, as I'm sure you're aware, Alderman Lopez, the coordinated entry process, homeless households are directed to contact that line, 1-844-800-9911. They get a coordinated entry worker who does an assessment of their need, may identify some optional resources, and then based on that assessment, they may say, well, we can connect you to a shelter program, or if there's no shelter available in the community, they may refer them to municipal welfare. If they come in to see us, we look at that coordinated entry assessment. We do an eligibility evaluation and say, do you have resources? No. There's no shelter we can connect you with. We may put you in a motel temporarily. Now, we don't have any housing to put them in, so we have to give them some paperwork, an application, a rental form, say, find a motel that will accept our voucher payment, and we can assist you temporarily until shelter becomes available. So that's basically how it works.
Is the coordinated entry program, is that staffed 24/7, or I know a lot of these questions,
Yes,
but I don't think the rest of the board does.
The coordinated entry process is basically an 8 to 5, 5 days a week process. The state is developing they've had a homeless hotline through 211, and they're working on expanding that process, and I think there is more coverage. I'm not completely sure if it's 24/7, but I think if it's not, it's very close to that.
But the one we have, you say, is running Monday through Friday.
The one we have local in the Greater Nashua Region, Monday through Friday, 8 to 5.
And that's supported by a nonprofit organization?
That's supported by a partnership of nonprofit organizations within the community.
Mm-hmm.
I'm trying to recall who we have answering that phone line. Southern New Hampshire Rescue Mission, the Front Door Agency, Bridges, Domestic Violence Services, Harbor Homes, Nashua Soup Kitchen and Shelter. And I hope I covered everybody that's
So
answering.
they would respond to calls that are sent to them, but they don't necessarily answer it.
They may get the call directly. If it does go to a voicemail, they should respond to that call within a reasonable amount of time, complete that assessment with the client, and then make the referral accordingly.
So a lot of the services that city welfare is able to offer to citizens that were obligated by New Hampshire's state charter to provide are done through partnership with nonprofit organizations?
Our mandate is to provide general assistance
Mm-hmm.
or to help the client meet whatever that need is. So if they came in and they were homeless, for example, and we could connect them to a shelter resource, that would be where they would need to go. If they said, I don't want to go to a shelter, I'd rather be in a motel, we'd have to say, well, unfortunately, the resource.
But
we
you
have to
directed
offer
them to
you
resources
is the
unless
shelter
those
program
resources are
that will
full.
meet your need. It's a temporary resource. So, we do work in partnership. Sometimes, in some cases, we may provide a little bit of assistance and then a partner agency may supplement that, if you will. Let's say a rental issue. If a client's facing eviction, they owe $1,000, they qualify for $500 from the city. We may work with partner agencies to come up with the other $500 so that that need can be met.
Is there a point where somebody may not qualify any further?
There are eligibility requirements and certain expectations. Depending on the household, the case, what the details are of the case, there may be job search requirements, there may be requirements to apply for certain programs, housing supports, what have you. And if they fail to meet those requirements, they may no longer be eligible for our assistance.
All set, Alderman Lopez?
No, I have another question. If they're not eligible for services, how long until they become eligible again?
In most instances, it's until they fulfill those obligations, those requirements. The statute calls for a minimum of a 7-day or, in the case of a second offense, a 14-day suspension period, and until they comply with the requirements. So if someone gets suspended initially, it's for 7 days, and then if they come back into compliance, they can get further assistance. If they don't comply a second time, it would be a 14-day period, and until they comply.
So knowing that we have the endowment, I was asking because I don't know how big the list of people who are not eligible for services are, but if it's large right now and at some point next year eligibility changes or people can apply again or are in need again, you're confident that we won't have to use the endowment to meet that need?
I would say that hasn't been an issue in my experience. It's not that great of a number of folks that are out of compliance and come back into compliance.
All set, Alderman Lopez?
My last question, and I promise, is about how many people does the intake person evaluate on a monthly basis?
That's a good question. I don't have that figure off the top of my head. It could be anywhere from a half dozen clients a day to 10 or 12 a day, depending. It all kind of, it depends on the day, the time of year. Many factors, sometimes the bad weather.
Whether it's snowing in April?
Yeah, the bad weather. We may get more no-shows for appointments. So there are a lot of factors that could influence that. I could look further into those numbers for you and get those to you.
Can that be on the list of questions?
Excuse me?
Can that be on the list of questions you asked the mayor?
It's going to be in the minutes, and anytime there's something asked for, we're going to get a response.
Okay, thanks.
Monthly intake.
How much does the intake coordinator work with people?
Alderman Wiltshire, did you have a question?
Thank you.
You're all set. Anyone else? That trust fund,
Yes.
if you expend money out of that, do you have to come back to the Board of Aldermen and ask for it?
I do believe so, yes. I can't just
Right.
spend money. It's been a while, so
Yeah.
I don't quite remember the process, but yeah.
I'm pretty sure that was the answer. I
it's-
just wanted to get
yeah,
it on the
yeah.
record. Also, I noticed up front that some of those ordinances you referred to are pretty old. Any of those ordinances need updating? A lot of things have happened since '78.
The statute, again, that's been around for quite some time. There have been some minor changes to it over the years. The guidelines themselves, they're pretty consistent. They just talk about our process and that we have an application process and that people can, how they can apply, what their responsibilities are, what ours are as welfare officials. So not a lot of that changes over the course of time. There have been some minor changes to it over the last 10 years. It's those financial standards that change more regularly, so.
Yeah, I was referring to the ordinances that were '78, so.
I'm
Okay.
not sure which one you were referring to.
Oh, when you, in the first slide, where you referred to I think the state statute, and you then referred to, there was several ordinances listed. I can find the page.
Yeah, and that's all part of the city charter. just describing the position and the services provided through the position.
Okay.
Um,
Any other questions? Any follow-up, Mrs. Mackley?
Yes, Chairman, just wanted to, convey the, the diversity that you see over at the division across the 4 departments, the work that's provided to the community at large. Over at the division, we see city constituents that represent diverse groups of individuals across all economic levels, across different ages, depending on the services that they're there for. We have worked very hard to improve our performance management and our delivery of services with our workforce development, with each of the departments creating missions and visions that help incentivize the work that's done by each of the staff that are there and that are led by the managers that you see here. As the division director for the past couple of years, I've been very proud of the work that has been accomplished by the staff under the direction of the managers and the enormous support that we get from our partners, because as you can see, in order for us to be effective at the work that we do to address delivery of those essential services and meeting those core functions of public health and addressing those social determinants of health that help maintain a healthy community, we have to work with our partners. As you've heard from the different departments, that is done in a systematic way. The support that we get from the city with the budgets and the grants allow for us to do that work. The funding is very important for us to be able to maintain that, and as grant opportunities present, we will continue to seek funding so that we can build our public health workforce. With the size of the city that we have, our health department the staffing is considered small, but we have been doing a good job, and I would hope that we will continue to be able to maintain that level of performance that allowed for us to receive the accreditation that we have at the national level. And I thank you, Alderman, for your support as well.
Thank you. All set? Thank you very much for coming in.
Thank you.
Appreciate the input.
Thank you. Thank you.
Okay. Motion, Alderman O'Brien?
Yes, Mr. Chairman, I would like to make a motion to table R18019, which is the budget.
The motion on the floor is to table R18019 until the next budget meeting. Any discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. General discussion? None. Public comment? No members of the public here. Remarks by Alderman. Alderman Lopez.
On behalf of Alderman Karen, I'd like to remind the public that on Thursday, there is a baked potato festival starting at 4:30 at Nashua Senior Center.
Okay. And we do not need a non-public. Is there a motion? Alderman Wilshire.
Move to adjourn.
Motion is to adjourn. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. We're adjourned at 8:23.